Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Before we begin, a note from our sponsor. I'm Richard Jacobs, Executive Director of the nonprofit Finding Genius Foundation and host of the Finding Genius Podcast. In late 2016, I was rear-ended at 65 miles an hour by a truck on the highway, which sent me off-road into a ditch. The impact of the collision gave me a concussion and other injuries. At the hospital, a CT scan showed that I had thyroid nodules, which turned out to be cancer. It was then, when I had a biopsy of my neck, that I realized even if I was a millionaire, I wouldn't want a second or a third biopsy due to the pain and the invasiveness of it. And appointments at that time for thyroid experts were 3 to 6 months out. And I was worried about dying now, even if that was irrational. So because of this, I've decided to raise money to conduct a literature review on steroids, on the causes of anxiety and depression, a condition that affects well over 50 million people in the United States and hundreds of millions worldwide. Our goal is to create a codex, a guide that reveals all possible treatments for anxiety and depression for people that live with the condition, or for loved ones that have it, as my wife and my son do. To find out more about our fundraiser, visit findinggeniusfoundation.org and click on current initiatives. And now to our guest.
Hello, this is Richard Jacobs with the Finding Genius Podcast, now part of the Finding Genius Foundation. A quick note about the foundation. We've embarked upon a massive literature review of the causes and treatments for anxiety and depression and PTSD. So to find out more about the effort, go to findinggeniusfoundation.org. And today my guest is James M. Greenblatt. He's a functional psychiatrist, part of the Orthomolecular Hall of Fame inductee. He's the author and founder of Psychiatry Redefined, and he's a pioneer in the field of integrative medicine. We're going to talk about his clinical and his research work. So, James, thank you for coming.
My pleasure. It's good to be with you today.
So are you engaged in seeing patients only, or are you doing research or a mixture? Like, what's your work schedule like right now?
Well, I've been practicing psychiatry for almost 35 years and always doing clinical work, so always seeing patients and training doctors. And I don't do formal research, but the work that we've been doing over 35 years is just different and off kind of the traditional symptomatic treatment in psychiatry. So there's clinical research, I guess is the term I would use, not academic published paper research.
Okay. And within psychiatry, what have you chosen to become your focus? What kind of conditions?
Well, I've gone through the list. I'm a child and adolescent psychiatrist, and we have now 7 books. And so I'm slowly getting through most of the major psychiatric disorders, ADHD, depression, anxiety, schizophrenia. My focus over the past 20 years has been in eating disorders, anorexia nervosa, binge eating disorder, and bulimia, which is the most life-threatening of all major psychiatric disorders.
Which one? Anorexia or bulimia? Or
well, anorexia. And the highest risk of suicide is anorexia, and the highest mortality rate of any psychiatric illness is anorexia nervosa.
Well, I guess let's focus on these conditions. So how does anorexia and/or bulimia and or other conditions arise? Like, how do they tend to start in a person?
Well, my work as what I would call a functional medicine practitioner focusing on mental health and mental illness is, looking at genetic vulnerability. Most of our major psychiatric disorders have a genetic vulnerability, but it's just that liability doesn't mean you're going to get depressed or anorexia. It means there's a likelihood that the genes run in your family. And the work that we've been doing is looking at these nutritional deficiencies and metabolic abnormalities that can trigger this genetic vulnerability. So the bulk of our work over many years has been understanding how nutrition affects brain function and how malnutrition affects major psychiatric illness.
what have you seen as the tie between nutrition and psychiatric illness? Does the illness arise first and then the eating commensurately gets worse? Or is it someone's been eating poorly for a long time and then this is one of the fallout consequences?
It's a little of both. And it's not necessarily eating poorly. A lot of the patients that we're seeing have been, eating the perfect diet or thought it was the perfect diet, organic, whole foods. But they either have genetic vulnerability to low levels of certain nutrients. B12 is very common, and or there's a abnormality in absorption. Things like celiac disease, other inflammatory bowel diseases have much higher rates in those with a major psychiatric illness, and those aren't always looked at by traditional psychiatry.
Well, from a functional medicine perspective, do you do a blood panel and look at hormone levels, et cetera, and then make recommendations, or how does it work?
Yes. I mean, I think Dr. Amen was the one that said it. Psychiatry is the only field that doesn't examine the organ we're treating. And so our current model in psychiatry is just making educated guesses based on symptoms. So yes, blood work and objective tests, hair testing, urine testing, blood testing, all genetic testing, all can provide data to help us make decisions as to how to treat patients with major psychiatric illness.
Well, what are some of the common pathways that are disrupted or downregulated or upregulated that lead to these conditions?
Well, some are really kind of very simple but ignored in psychiatry. I mentioned vitamin B12 and vitamin D deficiency. People think about it for bones and for immune function, but vitamin D is required to make serotonin in the brain. So we see vitamin D deficiency associated with both depression, anxiety, and dementia. And there's good research to support it. And many of the other B vitamins, as well as what we call these, toxic heavy metals. So lead in children, mercury, cadmium. These are heavy metals that interfere with absorption and can produce psychiatric illness.
Which kind of imbalances seem to predispose someone to, is it specific enough where you can tell based on imbalances or genetic pathways or et cetera, this person is much more likely to have a problem with bulimia versus anorexia versus something else? Is it that specific?
No, that's a good question. I think what we look for is nutritional imbalances, but the core foundation of functional medicine, if you will, is concept of everyone's different, biochemical individuality. So a vitamin B12 deficiency might look very different in terms of symptoms in, 10 different people. Someone might have classic fatigue. Someone else might have anxiety and panic attacks. So there's not, when we talk about nutrition, it's very hard unless we have severe vitamin deficiency disorders. It's very hard to say this deficiency results in this symptom. It is really unique for that individual.
If someone has anorexia or bulimia or one of these conditions, they don't look into diet or genetics, et cetera, and they rely on like CBT or other therapies or talk therapy only, are they likely to get help, or is diet critical, or understanding the genetics critical in order to being able to overcome these conditions?
Well, I think they are. Our treatment rates for eating disorders, anorexia in particular, is not good. There's a high relapse rate, and there's really quite diverse treatment programs looking at it differently. So no one has really addressed what is obvious. Someone who's been restricting their intake for many, many years, having nutritional deficiencies. So it's a lot about, restoring weight, a lot about therapy. Not as much attention has been placed on these nutritional deficiencies in terms of treatment and recovery.
What would be a typical path of help that you would go through with someone that has anorexia or bulimia? Do you do blood work first? Do you do genetic genotyping first? What's a typical process?
Well, I think anorexia is probably, a little easier to describe because it's very homogeneous disorder. The symptoms are quite profound and life-threatening. And we assume that all of our patients with anorexia are malnourished. So testing would help us to understand if there is genetic deficiencies or changes that would affect nutrients or breakdown of neurotransmitters. So genetic testing, looking at vitamin levels, mineral levels, amino acid levels, and then starting supplementation. So in addition to the therapy, in addition to the refeeding and support, our approach is looking at nutritional supplementation to enhance the recovery and the poor outcomes that we've had for half a century.
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now, back to the show.
With anorexia and bulimia, though, part of the approach is diet-focused. How do you get them to eat the supplements? What if they fear that the supplements will make them fat or, they throw them up? Then what do you do?
Yeah, no, a very good question. I think when, the way I approach anorexia, and I've been doing it for a long time, is because their fear of weight gain is so profound and often leads to death, that we, avoid that and focus on symptoms that they want relief from, which is usually their digestive, their nausea, their bloating, and their anxiety. So we help them understand that the supplementation will decrease anxiety, help them sleep better, decrease the digestive problems they have. So we use digestive enzyme, probiotics, and supplements like zinc, which will help digestion. And as they improve, then they're much more motivated to participate in treatment and understand that they have an illness. The core symptom of anorexia nervosa is this distorted body image, believing that they are overweight when they're malnourished. So it takes either sometimes medicine, oftentimes nutritional support to kind of help with that distorted body image.
Is it, again, because part of the solution is nutrition, do you have to give like IV fluids, or like what do you do if someone's really having a problem and the treatment itself they just won't engage in because of the eating problem?
It takes time and patience. There are times we need IV fluids. There are times you need NG tubes. But oftentimes, with encouragement and support, they'll slowly be able to restore some weight. And the nutritional supplements, one, they're no calories, so they don't struggle as much taking the supplements as they might with, rapid consumption of food.
And do they feel about the supplements that they are food, or do they feel like they're other or medication? Like in the mind of the patient, what have you noticed?
I think many patients do feel relief with some of the supplements. It helps, again, their anxiety, their sleep, sometimes the depression, and difference becomes motivating, for further treatment. The goal is really helping them want treatment and get motivated for treatment, because when anorexia nervosa becomes life-threatening is when our patients don't believe that they have a problem, even though they have malnutrition and a life-threatening illness.
How long does it take to progress either anorexia or bulimia to a point where you're like medically in a lot of danger?
We're seeing kids much younger. We've admitted kids 8, 9, 10 years of age. It can progress very quickly. So it really varies. But we've seen, averages between 12, and we've seen, 70 and 80-year-old men and women as well. So, usually a change in diet, either going on a diet to lose weight.
Does it happen more in young girls versus the overall population? And, for older people, it's kind of strange it would happen after all that time.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Yeah, I think typically it is, adolescent women more than men, although the rates are going down. But there's a significant number of women, more middle-aged, that struggle with eating disorders and don't always get the treatment that they need, because people just assume it's just a, adolescent problem. But no, people throughout the lifespan struggle with serious eating disorders.
Why would this affect someone in their, 20s, 30s, 40s, 50s, 60s, 70s? Like what happens in a person's life where it didn't affect them all their life, and now that they're older, it affects them?
They might have maintained their health and maybe they were exercising, running marathons, and being able to kind of control intake of food at that point. And they might have had a knee injury and they couldn't exercise. And then they start worrying about weight There could have been a stress or trauma in their life. There's a high incidence of trauma, even PTSD, in adults who are admitted to treatment programs for anorexia nervosa. So any major stress, again, with that genetic vulnerability and the nutritional deficiencies that follow, could result in an eating disorder.
And why is anorexia a lot more dangerous than bulimia?
They both could be life-threatening. Bulimia, there are electrolyte abnormalities. But anorexia, besides, again, the low weight and the malnutrition and the subsequent, cardiac disease and health consequences, as I mentioned, suicide is a common cause of death. And so there's the highest suicide risk in our patients with anorexia nervosa. And the longer they struggle with this disorder, the higher the risk.
What are some of the long-term consequences of bulimia? I would think you would get the same malnutrition, the acid eating away at the esophagus. It seems like, I guess, anorexia is more acute and happens faster, but bulimia should be, I would think, just as damaging, or is it not?
No, absolutely. I think many patients, with bulimia, the treatment models are a little easier, but the electrolyte abnormalities, potassium is life-threatening. Some of the damage, I just saw a patient that their complete teeth had to get redone in their 20s because of the purging behaviors. So there's severe medical consequences to bulimia as well.
Are there any new treatments or new trends that you're seeing in anorexia and bulimia?
Well, I think like everybody else, there's research on the psychedelics. People are looking at transcranial magnetic stimulation and ketamine, but nothing really has kind of dramatically shifted in the treatment of anorexia, except for there's now a much clearer acknowledgement in the medical community that anorexia is a brain-based illness. So that has been shown with major international genetic studies and other research, MRIs, PET scans, versus 20 years ago when I started, people still blamed families and parents and the kids as a disorder of willpower. But we now know it's a brain-based disorder. Treatment have not shifted. There's not tremendous breakthroughs. My work is just trying to educate people on how malnutrition is pervasive, and if we treat it, outcomes improve.
Well, what's changed over the past 18 months with, the virus situation in terms of these two illnesses?
Eating disorder rates have almost as doubled. Every eating disorder program in the country and around the globe have waiting lists. People can't get the help they need. What's happened in the pandemic has resulted in a major increase in both the number of kids with eating disorders and those seeking treatment.
Why do you think that is? Is it just overall stress has pushed people in these directions, or is there something else causing it?
No, I think it's, the same formula. There's genetic vulnerability. The kids that I've talked to that kind of been at home, bored, stressed out, so they might go on a diet, lose a few pounds, and then some individuals can't stop, and that's that genetic vulnerability, anorexia. So some of it is just trying to lose some weight and then can't stopping. Other it is just the stress and a lot of people, the visuals on Zoom, people comparing themselves and struggling with body image. Again, genetic vulnerability, stress, nutritional deficiencies, kind of the formula. And I think COVID has just kind of put gasoline on that fire.
Are there any particular molecular pathways or genetic predispositions that make the likelihood of anorexia or bulimia many, many times higher? Or are they all more subtle nudges and propensities towards having these problems?
Well, we see a high propensity of another psychiatric illness, called OCD, obsessive compulsive disorder. So oftentimes there's family history of OCD, or the patient might have OCD, which means they have, the intrusive obsessive thoughts. It might be around cleanliness or germs. And then it starts to focus around food and body image. So OCD is probably the most common path. And then, as I mentioned, trauma and stress is also a path towards an eating disorder.
Does self-harm play a role? In addition to, not eating well, et cetera, or throwing up, cutting, things like that, do they tend to be ride-along issues with anorexia and bulimia?
Well, I think they're common in kids now. So we see it in adolescents across a lot of psychiatric illnesses, depression, anxiety, and certainly anorexia and bulimia. The self-injury also we found has been related to nutritional deficiencies, particularly those kids that aren't getting adequate protein. Some of our longstanding vegan and vegetarians is, I believe, a major risk factor in adolescence. When we get through puberty, we need extra nutrients like zinc and fats to support brain development. And these restrictive diets can result, in my experience, in increased self-injury, cutting, not being able to kind of regulate moods.
What are your thoughts going forward on what's going to happen with, mental illness in general? Where do you see the trends going? Are they shifting towards more younger people, more kids? So what are the major trends you see evolving over the next couple of years here?
Well, I mean, I think, people have used words like epidemic or tsunami of mental health and mental illness as suicide rates continue to increase. So I believe the good news is people are talking about it, celebrities, athletes. So now we can talk about depression and anxiety. My concern is the current model of treatment is just, polypharmacy, is medications. And I believe there's many other opportunities to intervene with lifestyle changes and the nutritional psychiatry that we've been focused on for many years. So there's awareness, but I think the field of psychiatry has a long way to go in extending their model beyond just medication.
Are there more functional psychiatrists like yourself coming out, or is it still like most of the psychiatrists that people will find are the traditional, like, here's an SSRI type person?
No, I think things are changing. I was just at a conference. It's called Integrative Medicine for Mental Health. Between online and in person, there were almost 500 clinicians. This was for professionals. We have a training program, a fellowship where we train doctors, and more doctors, both early in their career and late in their career, are interested in learning this material. So absolutely, field of integrative and functional medicine is growing and looking towards mental health and mental illness as an approach.
Okay, very good. Well, James, what areas and where and how can you help people? Like, if people want to find out more, where can they go to find out more about you?
Well, our website, jamesgreenblattmd.com, is where we have the books, which are written for consumers. And then our professional training is at psychiatryredefined.org. There's lots of free webinars and courses by doctors who've been doing this for many, many years. So there's a lot of information to share. Okay.
Well, very good. Well, James, thank you for coming on. And I'm glad there are psychiatrists that are moving towards more of a functional approach, because it just seems like, the more holistic, the better. So thank you for what you do.
Great. Thank you, Richard, for the work that you're doing. So I appreciate it. Thanks for having me on.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.